Once you're home, you should only have mild pain or discomfort. You can take acetaminophen, such as Tylenol Extra Strength, to help. If your pain cannot be controlled with your prescribed pain medication, you should call the nurse navigator or go to the emergency department. You'll need to take the antacid medication every morning for 3 months. It comes as a pill, which you can swallow whole. Constipation is normal after this surgery. You might not have a bowel movement for up to 5 days due to your recent surgery and change to your normal diet. Take your laxative to relax your intestines and loosen your stools. This will help you have a bowel movement. Your laxative should be taken each day you need it before going to bed. If you do not have a bowel movement by the 5th day after your surgery, take a glycerin suppository. You can buy stool softeners and suppositories at any pharmacy. You do not need a prescription.